Mr. Chairman, I believe we're ready to go.
All right, thank you. We'll call this meeting to order of the Eastern Idaho Public Health for September 24th at 7 a.m. We welcome everybody. Let's begin with a roll call of our board members to ensure we have everybody present. We'll begin with our physician, Dr. Nelson.
Barbara Nelson here.
And Teton County.
Bill Lake, present.
Fremont County.
Lee Miller, present.
Custer County.
Wayne Butts, present.
Lemhi County.
Ken Minor, present.
Clark County. I didn't see Commissioner Shenton. He may be joining us here shortly. Madison County.
Brett Mendenhall here.
And Jefferson County.
Shane Young, present.
And of course, I'm from Bonneville County, Brian Reed. We appreciate our director, Jerry Rakow, as well as our epidemiologist, Mr. James Corbett, and other staff who are there at the building. This meeting is being held with Zoom webinar, and it is also streamed on our YouTube channel for the public. There's also a room at the location of Eastern Idaho Public Health for any public who comes to that location to join the meeting. We also welcome and appreciate some guests that are with us. We have Dr. Buitrago and Dr. Lofgren, who will be providing some information to us later in the meeting. We also hope to, I'm not sure if they're with us yet, but hope to have representatives from the hospitals with us to also keep us advised. So we will jump right into our agenda. First, we need approval of September 14th Board of Health minutes. They were sent out and they're on our website. If there's no concern, I would entertain a motion to approve.
I move we approve the minutes.
Thank you, Dr. Nelson. Is there a second?
This is Bill Lake, I second.
And all in favor, say aye.
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 Thank you. Those will be filed. We'll move right into our review of public comment. Many of the comments that we did receive during the week were either answered directly by email or they will be discussed during the meeting today. I might just mention a couple others. We did have some letters with concerns about how many people are actually following the recommendations and the orders from East Idaho Public Health, and concern about that. We had a question about splitting Jefferson County due to the difference in miles and the other geographic differences from East and West Jefferson. Jerry, do you want to briefly speak to that now?
Sure, Mr. Chairman. That is something that we have talked about from the very beginning. We have several of our counties that are geographically spaced. One example is Jefferson County, another is Custer County, where we have Challis that is very separated from Mackay, that's very separated from Stanley. Part of our challenge is trying to maintain individuals' privacy. And in our very small communities, if we are to report that we had a particular case there, it could easily identify the individual. And so it's very challenging for us to be able to put numbers out for specific small communities and maintain privacy. We continue to talk about how we might better represent those numbers so that the communities can be more informed. But I will just say, unless a community is isolated and there's no travel anywhere outside of that community, the risk is still there. People travel to other areas for work, school, sports, travel to other areas. So every time you step out of your home, there is a potential risk of you coming in contact with COVID-19. So even if we were to identify certain cases in a community, and I would also say that we have lots of other people that are out there that potentially have COVID-19 that never get tested and that are never, reported to us as a case. So there's lots of challenges around that. It is something that we have discussed and continue to discuss, and we just don't have a resolution to how we would be able to do that and still maintain individuals' privacy.
Okay, thank you. And I understand the need to respect that and the legal responsibility too as well. So thank you. I wanted to mention a letter that came in late last night with an individual had concern about a large gathering in Porter Park. They reported over 1,000 students shoulder to shoulder, doing what students typically do. And I wrote back to them and explained that although, East Idaho Public Health and health districts does have the legislative authority that has been put upon us in state code to set orders, we do not have the enforcement authority, which would be the executive branch, or, in this case, it'd be local law enforcement. And they returned the email and said they understood that, and they actually don't want to see it come to law enforcement happen to enforce these. And I don't think any of us do as well. We just would rather not see that happen. We would hope that people would. I appreciated this person said, but there has to be some sense. And they said even my 15-year-old son was shaking their head in disbelief. And so I would just hope that, everybody sees that. I mean, we want everybody to be able to continue on with all the activities possible and the opportunities taken away from college students. But I just hope everybody will be careful in their actions and will listen to the recommendations from East Idaho Public Health. We'll go ahead. I think there'll be more discussed later. We'll go ahead and move to reports from our hospitals. I do see some with us, and we do appreciate the time you take each week to keep us updated. We'll go ahead and go to Eastern Idaho Regional Medical Center. Mr. Hoffenberg.
Hello, this is David. Can you hear me?
Yes, good morning. Thank you for being with us.
Good morning.
What is your staff?
Absolutely. Thank you for having me. Just to update the group on first where we are as a hospital, again, we are very full. It is largely due to COVID. We have 20 patients in the hospital, and we're running a census of about 240 right now. Of that, 45 is in our behavioral health centers. So we're running right around 200 for the main hospital, which is very, very full for us. And so we did max out our adult med surgical beds last night, and so we do have an overflow unit that we're ready to open if we do see our patient load continue to tick up and no discharges, particularly if we see our COVID patients sticking around. So we are preparing if that were to happen. I did see the reports earlier this week around Bingham and Portneuf and their capacity and census capabilities. And so we are seeing, I think, some of the patients from those areas come up this way. And so we're really focusing on throughput and trying to expedite discharges every day as early as we can to make sure we're handling the capacity that we've got. But as of right now in the ICU, 7 are in the ICU. All are currently ventilated. So of the 20 that we have, the majority are not med-surg level, but a good amount are, and very, very long stays at this point. So we are seeing the sickest of the patients are seeing length of stays that are substantially longer than the med-surg patients. But we're hanging in there. We are hoping that this weekend we don't see another busy weekend like we did last, and that we're able to just continue to maintain the capacity that we've got. So we've got plans in place if things turn for the worse, but in the meantime we're holding steady, but again very busy.
All right, thank you. So to understand you correctly, due to the capacity in Bingham and Portland, you are seeing some overflow from those hospitals as they are forced to emerge. Is that correct?
I would say it's to some degree, yes. So I mean, we typically get higher acuity patients from those communities anyway, but we are seeing just a consistent number of patients from Bingham County and then a few from Bannock. So I don't anticipate, we're in contact with those administrators, and it sounds like things are steady there as well. They're kind of in the same boat as us, busy, but managing. So that we typically do see those higher acuity patients, which then, take up our ICU capacity. And so right now we actually, where we have the majority of our adult beds is in our ICU. So I think that's encouraging, but our adult med-surg beds are where we're really tight. And so our plans are, if we did have the need, we would open up a 12-bed med-surg overflow unit.
Okay. Thank you, Mr. Hoffenberg. Mr. Jackman from Idaho Falls Community.
Good morning. Thank you for having me.
Good morning.
We're sitting just south of 50% full. We have seen a big uptick in COVID over the last 2 weeks. We currently have 3 COVID patients in the ICU on ventilators, and another one that is on a high flow nasal cannula. We've seen quite a range in the age of our COVID. In the past, we would see a lot of older COVID patients. We currently have a 45-year-old, and we've had a 22-year-old that were both with us for quite a while, that were fairly sick. We're kind of in the same boat as far as maintaining steady. We have approached several times over the last 2 weeks our first warnings level on our algorithm, watching our resources, but we have not surpassed that first warning level. So we're continuing to hold steady, and we're ready to move past that if it happens.
All right, thank you. Are there any questions? We'll go ahead, and if there are questions, we'll have a minute after. We'll go to Madison Memorial. Dr. Gonzalez, good morning. Thank you for joining us.
Good morning. Can you hear me okay?
Yes.
So pretty similar to the other reports, we're busy. We're at 85% capacity in our mom baby side. As everyone knows, we do lots of babies. So little good news this morning. We've got a lot of that going on. Our med-surg floor, we're about 60% capacity. We have 2 COVID patients at the moment. Sadly, we had one lady pass away, a 54-year-old this week. And just a couple points I wanted to point out. One, I know we had it's always a trouble with, or not a trouble, but it's always a challenge for placing patients who need inpatient mental health services. BHC, there's a lot of great facilities that help us out, but just due to demand, we don't always have those resources. Our hospital's working on an inpatient unit, but won't be ready for a year. That patient was also COVID positive. One of the patients we had this week was COVID positive at the same time. And that was also a challenge as far as placing. So I guess I'm just trying to continue to underscore for everyone that this isn't just about our COVID patients. It's kind of the mix of all the patients that we're taking care of, you know, the positive moms that we have. There's, you know, just a lot of resources and busyness that goes with all of this. But I think it was said well by David.
We lost you. It looks like you muted there. So if you were
Somebody didn't want to hear me anymore. Sorry. I just wanted to say that it's been very helpful in Madison County for the college to start a drive-through testing. With the amount of testing that's going on in our county and all the rates that we've got, it's helpful to have the demands and the resources being saved at the hospital some, and some of that help from the college. That's all I have until I introduce Dr. Lofgren, but thank you.
Thank you very much. We do appreciate that report. And again, we appreciate all three of you and the time that you take each week to keep us updated. That's the main reason we do what we do, is to try to support you and the capacity that you have, and allow you to be able to manage resources to keep our communities safe and healthy in all aspects. And so again, thank you. The discussion will continue somewhat, so we'll go ahead and move to item 5 in our agenda, which is an update. And I'll turn the time over to you, Jerry.
Thank you, Mr. Chairman. And I think we'll just start with the myth busting piece first. Now, at the end of our last board meeting, there was some question of how do we know what to believe? Conflicting messages that have come from the top level, from the president, from the CDC, from the World Health Organization, you know, right down to the local level. There's been mixed messages throughout this pandemic, and the fact of the matter is we're dealing with a situation that is new to everyone, and certainly things change over time. I wanted to share, because I think this plays right into our dialogue this morning. Dr. David Pate is a retired physician who was the CEO of St. Luke's Health System in Boise for a time, and he's serving on the governor's coronavirus working group. And he did an interview with the Idaho Statesman last week, and I just want to share one little snippet because this question was asked of him. So if you will give me just a moment to pull that up. Are you all seeing that on the screen, Dr. Pate?
Yes.
Okay.
Yes.
So the question posed to him was, you know, people are losing confidence. What do you have to say to that and the conflicting information that has been shared?
Are losing trust. Here's what I would say, and here's the approach I take. First of all, I try to get my information from people that don't have obvious conflicts of interest. So, you know, there are people who could financially benefit one way or another if people buy a certain stock, get a certain test, do things. I tend to discount people with a conflict of interest. And I think it's very important for anybody who's going to take a stand on these issues to be very clear. Do I have any conflicts of interest, or what are they? And so I think that's one. Number two is look at what the person's saying. Does this match up with what we're being told is coming out of clinical studies? And of course, I have the benefit, I can look at those clinical studies and understand them myself. And so is it squaring with that? Are they being led by evidence? Another thing is somebody willing to admit that they've been wrong? I've made a number of errors in judgment along the way, and I've admitted when I've been wrong. Fortunately, I haven't had too many of them, but I have had a few. And I think if somebody's telling you that they've been right about all of this, that's pretty suspect. I don't think anybody has been right about everything. I also think we need to cut people some slack for being wrong. I had one of my Twitter followers, for example, say, oh, well, you know, somebody told us back in February that we shouldn't wear masks. Well, I was one of them based on what we knew at that time. But we got new evidence. And so I was wrong, but I was right at the time based on what we know. And we need to cut some people some slack, because what we don't want to get to is a situation where people that are knowledgeable, people that are experts say, like when you're asking questions, I'm not going to comment because I'm not sure it's not going to be different a month from now. And then I don't want people looking back and saying, see, he was wrong. That's not a good environment for us to have. We want people to evolve their knowledge as we get more evidence. And with a novel virus, obviously, we're going to be learning a lot more now than we were back in March. And I think that if you can imagine back in February and March, when this was becoming an issue, had the experts that you reached out to said, we're not willing to comment because we're just not going to take all the criticism if it turns out to be wrong, I mean, people would be in an uproar. And I think most people understand that we're going to tell you the best of what we know today. When we get more evidence, when we study larger populations of people, we may come up with a different answer, and we'll tell you then. But I think that's a criteria to use. If somebody says they've been right on everything, discard them. If people say they've never been wrong or haven't changed their views about this, discard it. The other thing is, if people are making this political, if people are being guided by things other than the science, it's just because of their political views, and all of us have political views. I have political views, but I do try to keep that separate from, well, here's what the science says. And of course, I criticized leaders of both parties when they've gotten things wrong, and we need to speak out. So it is difficult, but if you're getting your news from a source, first of all, where the person's not an expert. So I've seen some people share some stuff from me that, you know, I think one of them was like a chemical engineer was giving all this expertise about it. Well, you know, they might be right, but you probably shouldn't trust them as much as somebody who actually is a physician, who actually has some expertise in this area, and has treated patients with this kind of thing and deals with it, and doesn't have anything to gain by influencing you one way or the other. Just wants people to have good information.
All right, I'm gonna just stop that. I thought it was just a good lead in to our dialogue this morning. And so if you're okay, Mr. Chairman, I think we should start with Dr. Nelson and let her comment. And we do have Dr. Buitrago, who is our infectious disease specialist and consultant for our Eastern Idaho Public Health Board. And before we start, Dr. Gonzalez, could we ask you please to introduce Dr. Lofgren?
Absolutely, my pleasure. Dr. Stephen Lofgren, I'm quite biased about this physician. I think he's one of our top physicians at Madison. Dr. Lofgren has also worked at Eastern Idaho Regional Medical Center and, of course, other hospitals. He is an internal medicine physician, has, Dr. Lofgren, I don't remember how many years you've served as a hospitalist for us, but he's a great representative for our community. He currently serves on our medical executive committee at our hospital, but can certainly speak to the inpatient and outpatient and community aspects from Madison, and of course as an internal medicine physician. And that's Dr. Lofgren, but I could go on for a little while about him.
Thank you. So Dr. Nelson, do you want to start?
Yeah, I've just noticed throughout this pandemic, It's a novel coronavirus, so the science is emerging and different policies and suggestions have changed. Early on in the pandemic, we were asked to reserve the masks for the healthcare workers, but then the data emerged that masks were very effective in slowing the spread of the disease. A lot of information has been placed about the masks protecting the people around you, but there's also some new data emerging that if you're wearing a mask and catch COVID-19, it will decrease your viral load, so there's a less severe illness in that case. We're seeing a decline in deaths, we're seeing a decline in hospitalizations because we're getting better at treating this virus. But some people in the public focus on old news, and you really can't do that. You have to stay current, you have to pay attention to the statistics. People will pull out old studies that have nothing to do with this current virus to support the fact that masking doesn't work. And that's just not what we should be doing. We need to stay current. We need to follow the science. And that's all I have to say.
Thank you. Dr. Buitrago, would you like to add anything to that? I know you're busy, but.
I'm happy. Yeah, thank you. Can you hear me?
Yes.
Yes. This is great that we have this discussion, and I'm glad Dr. Lofgren is on the line as well. We've worked together for so many years, and he's been a great asset at Madison as well. I am very happy to hear that some of you are taking the Johns Hopkins University course, because it's not really me telling you what to do, it's having like academic showing you the data and explaining to you why, for example, a 14-day quarantine makes sense. Just because, so showing you the number, and it would be so great if all the board members that kind of want a certificate like that and say, you know, people are making decisions for your health and your kids' health. Listen, we actually did the Johns Hopkins course. We all have the certificate. We understand. I agree with Dr. Nelson that things change all the time, and as physicians, I think we need to be checking on each other as well. There was that post last night that was quite dangerous. I called the physician. He's wonderful. I know him for years. We check it over. I explained the information. The post was taken down. There was a big incident in our area where a local endodontist threw a party with hundreds of kids attending, and I would like for the dentist in the area to actually call these people out. I mean, as professionals, if we don't call on each other and expose things like that, who's going to trust us anymore? I know we don't want to make these events legal, we don't want to arrest people, but I expect some accountability. And so, like I called out on the physicians that are not following through or are causing harm, I will call on the dental community to actually tell us that they're taking us seriously. That when my kid goes to an endodontist, that person is safe, that we follow our oath, and our oath is not to endanger people in our private lives either. I don't do things that would harm my patients outside of my office or inside of my office. So yeah, I think that's what I have to say. Happy to answer any questions, and so proud of all of you that are taking the course.
Thank you. And I appreciate you recommending that course. I got through the first module last night and I learned a lot from it. So it was great. Thank you.
Yes.
Dr. Lofgren, this question started at our last meeting from Commissioner Mendenhall, Commissioner up in your county. And I appreciate the question because it has been confusing to us that are not part of the medical community to understand why there would be conflicting statements from doctors. And so we appreciate your insight on this.
Yeah, so I appreciate what Drs. Nelson and Buitrago said. I 100% agree about the masking evidence, and it is evolving. You have to look at what's come out recently. There have been some wonderful papers published both in Lancet as well as New England Journal of Medicine, which are the two, I would say, leading medical journals in our area of the world. Lancet being essentially the British version of New England Journal of Medicine. Recently, New England Journal of Medicine published some information on variolation, which is essentially what Dr. Nelson's talking about, in that if you wear a mask, there's evidence that you decrease the inoculum, and that probably through one way or another, possibly giving us a better fighting chance, decreases severity of illness. A lot of the concern I have is active misinformation, and it seems that a lot of our patients get their information in lower forms than even Twitter, which would be little memes on Facebook, which are cute snippets of misinformation tied together in a way that convinces somebody of what they already believe, and that is that masks don't work, or that they raise your carbon dioxide level, which is puzzling to say the least, that these sorts of things are out there. I also think it's important that we not only educate the public on mask wearing and the importance of it as being probably the best tool we have right now in prevention of COVID transmission, but also that there's more than just the niche of survival or death from COVID. And if you look at just those numbers, I can see why people feel cavalier, that they're very unlikely to die from this if they get it. And so let's just suffer through it and it'll go away. There's a sizable group of people in the middle who can no longer take a flight of stairs or walk 200 feet because of the heart damage from COVID. And it's important that we emphasize to people that there are some long-term ramifications that we're just learning about from this disease. And so I'm a big believer in correcting misinformation about masking, correcting information about morbidity and not just mortality rates. And I'm also encouraged by what I'm hearing about the vaccine trials. I'm particularly encouraged about these the two leaders right now, Pfizer and Moderna. They seem to be doing very well as far as their trials go. There haven't been a lot of untoward events reported. And so I think we're close to the end. I think it's important to remind people that you don't have to wear a mask forever. We have to get through the next little while, and good times are right around the corner as far as fighting this illness.
Thank you. And thank you for ending with that, because that is certainly highest on my mind, and I know everybody is when this will end. There is a lot of COVID fatigue out there. I mean, it has gone on for a long time, and it is stressful and challenging for all of us. So I appreciate the encouragement to just hang on, because we will get to the end of this. And I do appreciate all of your comments. Are there any questions from board members for any of these professionals?
Mr. Chairman.
Go ahead.
Where I'm the one that raised the question, I appreciate these three doctors. Very open and very straightforward in what is happening. And my notes they're going to help me as I respond to people, some of the comments that they made. And I am still a little bit disturbed that, yes, the general public is not staying informed. I really worry that some doctors are not staying informed, that they're not reading the journals and interpreting for us. And so when we have three esteemed doctors like we do that are very, very open, and they say, listen, it's changing, masks are good, they're not taking away rights, they're letting you have some rights. So thank you to Jerry and to the doctors. We'll keep pressing forward, but I do worry that not only the general public is not staying informed, but I worry that some of the medical field, perhaps an orthodontist doesn't feel like he needs to read the same journals that Dr. Lofgren does, and therefore he speaks, but everybody believes that he is at the same knowledge level as Dr. Buitrago or Dr. Lofgren or Dr. Nelson. And that's where our conflict comes. But I'm learning the source of information. Where'd you get that information? Where did you get that voodoo from? Why are you saying that? Have you looked at what doctors are saying? So thank you. After all of that, thank you for putting this together, because it does help me in the responses that I'll have very much.
Thank you, Commissioner. Dr. Buitrago, go ahead.
I just want to mention that some of the data is free. And so every Thursday, New England Journal of Medicine has a little interview that is about 30 minutes. And I will encourage all of you guys to listen to it because it's like a little summary, an interview of what's happening that week or what's the news article. And so that's free. Nobody needs to pay for it. New England Journal.org, latest interview. And you guys should listen to it, while you're doing paperwork. That's what I do. I'm doing my notes late at night and I put the interview. And so that way it tells me, wow, I missed this before an article. And if you guys get a habit of listening to it, also JAMA, the Journal of American Medical Association, has a free interview. They're very fun, and they're free. And so they have Dr. Fauci on it. They have the head of the WHO. They have the head of the CDC, things like that. And if you don't want to sit down and review an article from head to toe, but you can listen to it while you're doing something at night or during the day, wherever you want to. That is one of the ways that I will tell people to keep up to date.
Thank you. And yeah, I would ask Director Radkow that you continue to forward us opportunities for, to learn more and these links. I know I mentioned that I thoroughly enjoyed the John Hopkins course that Dr. Nelson gave us the link for last night. It really helped me better understand some of the science in my position. So are there other questions for these three doctors before we move on?
It's Commissioner Young. I just want to thank the doctors also. And as a health board, I just hope there's some way that we can help the public understand, these are the experts we want to follow. I've made this comparison often that I don't go to a dentist for spine surgery and because, they're not the expert. And these people are, I really appreciate Dr. Buitrago and Dr. Loughran and Dr. Richards and others who have led us through this. And I think that's our big job as a health board, to dispel these myths that seem to lead people astray. And hopefully it's our responsibility to try to guide them through this. And thank you. That's all I've got to say.
Yeah, absolutely. Thank you, Commissioner Young. And
Do you know where my red lunchbox is?
Not all boards are fortunate enough to have a physician on their board as well. And so we are fortunate to be able to have that knowledge and all the information that Dr. Nelson can bring to us. So Jerry, what else did you have in this portion of our agenda?
Yes, thank you. Another thing that I think has caused a lot of confusion in our local communities of late is the isolation period for someone that has been exposed to COVID-19. On the screen, you can see a graphic. I'm going to turn to James Corbett and ask him to explain this graphic to everyone, and then we can answer questions.
Thanks, Jerry. Just as Dr. Pate has said, and many of the other physicians, certainly information continues to come forth. This was something that Annals of Internal Medicine had a study on early on in this pandemic that is still valid, but it's still, again, being looked at, even more closely as we get more and more information. On this chart, you can see the left-hand side axis there that's going up. That vertical axis is the proportion of symptomatic cases, and we're talking about, and then on that horizontal axis there, it's talking about days since really infection or since exposure to that infection. And they modeled this, and this is a good representation graph of how many individuals would, or when they would start showing symptoms since exposure. And you can see that middle in there, kind of right there in the middle, right about day 5. It's actually 5.1 days. 50% of the people will have will already be displaying symptoms since exposure if they're going to get sick. And you can see that continues sharply really up until about day 10, and it's actually just a little after day 10, day 11, and then it starts to plateau. That doesn't mean that it's all gone. Actually, at day 11, there's about 97% of people. And at day 14, there's 99%. There's actually some instances of incubation lasting longer than 14 days, but very few. This is one of the reasons why we recommend to isolate for 14 days from the day of from exposure date, because it can take up to 14 days, sometimes even longer a little bit, but 99% of the people will do it within 14 days to isolate. We get that question, and it's come up quite a bit. Why those 14 days for? And then again, this is just for those individuals that need to isolate or that had direct exposure with a case. This is not cases themselves. As to be clear, cases themselves are different altogether. Once you have contracted the disease, then we do know that you can be infectious for up to 10 days from symptom onset. Sometimes longer, depending on the severity of the illness, if you're hospitalized mainly. But for the most individuals who are in the general public, 10 days from symptom onset. But for those that are exposed, this is the chart really here that can explain why we're looking at a 14-day isolation from the last day of exposure.
Mr. Chairman, I would continue on that there are some exceptions to the 14-day isolation, and I know that's why there is lots of confusion out there. There has been established critical infrastructure workers that have a little bit different guidance. But for the general public, and the public health recommendation is that anyone that is exposed should isolate for 14 days. Now, I just want to say, because I know this is why it's coming up, is in our district, on our health district, we have school districts that have implemented policies that are different than our public health recommendation. They have reduced it to potentially 7 days of isolation and made other policies. But I want to confirm for everyone that public health's recommendation is if someone is directly exposed to someone positive for COVID, they should isolate for 14 days.
Jerry and Chairman Reed, if I may, just one other thing, the critical infrastructure as well, they do have that ability to maybe bring someone back that's on, not that are a case, but that's been exposed under certain guidelines, but that doesn't change the recommendation from public health outside of that workplace. They still should be isolating at home outside. So if a hospital chooses to bring back a nurse who has been exposed, for example, we would still recommend that that nurse outside of work, where they have tight controls over that individual that can, and protection, they still need to isolate away from their family at home and not go to, grocery stores and those type of things. Those are still our recommendations.
Okay, thank you. Is there anything else, Director?
That's all for that, unless there are other questions. And if there are not, then we will go on to the data review.
Board members, do you have any questions before we move on? Commissioner Mendenhall?
Mr. Chairman, thank you. I don't want to get into the weeds too much, but general public again, and myself included, when does the isolation start? When they were in contact, when the symptoms started to show, when they were tested. Now, don't go too far with me here, but there are going to be people that said, "Oh, I was at a party 14 days ago, and I'm just now starting to feel the symptoms." I mean, what would be a good rule of thumb for them to say, "I need to isolate"? When did it start? Anybody? I don't want to get in the weeds too deep, but I also want us to understand when that isolation period will start, because it's going to be important to a lot of people.
So I'll start, and then James can add on. For someone that has an exposure to someone that is confirmed positive for COVID, their isolation period starts from their last contact with that individual and continues on for 14 days.
All right, that makes sense. I mean, direct contact they know, and you know, perhaps the doctors would put in there the same. There's going to be people that are going to nitpick this, and they're going to say, "Oh, I'll use it to my advantage." But you know, if you're sick, isolate. But that always doesn't flow. So, okay, that helps me. Thank you.
And again, one of our top mitigation measures is stay home when you're sick, whether it's COVID or any other illness. That's how we're going to minimize the spread of any illness, is not exposing other people to it. So if you have symptoms, and I know COVID symptoms are very consistent with flu, colds, lots of other illnesses, but we just encourage people, please stay home when you're sick.
Mr. Lake, did you have a question?
Yeah, like Brent, I don't want to get into the weeds, but I think we're going to have to a little bit on this one to make sure we fully understand. So let's say that an individual was with a group of people 8 days ago, and on day 9, he starts feeling symptoms. Okay, so, and let's say then he goes and gets tested, and then 3 days later, he finds out he's positive. So from the day that he came down with the symptoms, we heard it, he's infectious for 10 more days. So
yeah,
that means that person really should have isolated for the 8 days that he was since he was at that gathering. And then once he found out he was infectious, then he needs to isolate for at least another 10 days. So that means he's in isolation 18 days. Is that correct?
Not necessarily, but thank you for that question. So once someone actually begins to exhibit symptoms, then there's different guidance for them. What we're talking about for the 14 days is those that have been exposed to someone, and during those 14 days at any time, they could experience symptoms. If after 14 days they are not symptomatic, they're released to go back to their normal activity and lives. Once someone becomes symptomatic, that changes things. And if they get tested and come back positive, we go back to they are asked to isolate for 10 days from the day they become symptomatic. So in your example, yes, Bill, it would be 18 days for that example. But people can be infectious for up to 2 days from when they become symptomatic. And that's when we do our contact tracing and identify anyone that an individual had been in contact with, close contact, which we consider 15 minutes within 6 feet of that individual. They're considered a close contact. And through our investigative work and contact tracing, those individuals would be requested by public health to isolate for the 14-day period. The case themselves, again, would be monitored by public health, and generally they're infectious for 10 days from symptom onset.
Okay, thank you. Seeing no other questions, Jerry, let's go ahead and move on then in our agenda.
All right, let me just bring up the data dashboard. Are you all seeing the data dashboard?
Not yet.
Hold on. Sorry, another share.
We see it now.
Okay. All right. You can see here the current active rates for each of our counties. Of note, right now, we have several counties, five counties as of today that are under orders of restriction: Bonneville, Custer, Fremont, Jefferson, and Madison. You can see that Madison rate is very high. It has continued to be in the 30s for many days. Clark, while it's at a rate of 35 per 10,000 population, that it only represents 3 actual active cases in that county, and that's because it's such a small population in that county. Both Teton County and Lemhi County yesterday bumped above the threshold that would put them into the moderate risk category according to our response plan. This is just the first day in there. Our plan stipulates that a county would be in above that threshold for 3 consecutive days. And so we'll talk more about that later. James, did you have anything else to add at this point here?
No, you're good.
You heard from our hospitals on the hospital capacity, but these 2 charts are included always. This is the ICU occupancy that's available. And you can see it's a fairly flat line, but it does track from day to day the percent of ICU beds used. And then the second chart is the overall hospital bed capacity. The last chart here is on testing, and unfortunately we don't have information beyond September 12th for testing in our region. I just want to go to the Idaho coronavirus website because they have been able to add they've been added testing information for each specific health district. And so if you've not been here and looked at this before, I'd encourage you to go take a look. So if you click on the laboratory testing tab, it gives the information for all 7 health districts. If you scroll down here, this is the statewide picture. Statewide, the percent positive has dropped to 6.9, which is the lowest point for 2-3 months now, which is a very positive indicator. When you click over here, you can look specifically at our health district, and you can see that the positivity rate for our district is also declining. Again, I anticipate that this information will be updated later today. It's the data that the state has, and so we continually watch this information, but you can come back here to monitor that. It was mentioned earlier by Dr. Gonzalez that BYU Idaho has incorporated in Rexburg, in a partnership with Express Lab, a drive-through testing clinic, but also other providers throughout our district are being able to get other testing capacity. We know that some providers are getting more rapid antigen testing capability, and all of that is going to help us going forward to be able to increase our testing capacity. As we sit here today, we still don't have the availability to test every single person that would want to test, and it generally is still fairly limited to people that are symptomatic. But we do anticipate that capacity increasing very soon. We reported the past 2 meetings, I believe, that Express Lab, in a partnership with both our health districts here and in Pocatello, as well as Idaho State University, is working to get a high throughput testing capacity at their site here in Idaho Falls that will add 500 or more tests per day that they'll be able to run on site. So give very much improved turnaround times for the testing that's going on. James, I'd ask, do you have anything to add?
I would just say that our own testing turnaround time has decreased since we've spoken 10 days ago. It was right around just under 3. Now it's just over 2. So that's a positive return, and it's not displaying very well there. I apologize on the screen, but so 2 days, and it's just barely over 2 days. We round on this to at least the 10th. So just over 2 days is really our average test return time right now for the last week. So that's encouraging that we're getting those results quickly. Again, as Jerry mentioned earlier, if we can isolate individuals who might be feeling ill and their close contacts, we can help reduce that spread, in a lot greater efficiency.
I would also just share that we have seen cases increase in our health district. Yesterday, we reported 121 new cases. And certainly we're seeing the impact of school being back in session and teachers, staff, and students being affected by COVID-19. In addition to those that are testing positive, we are seeing the impact of individuals having to isolate because of being in close contact with others. And so we continue to work very closely with the schools. You all know that we provide recommendations to the schools, but it is ultimately up to the local school boards to make those decisions and policies of how their school is going to handle the COVID-19 response within their jurisdictions. But I will just say it has certainly been challenging for the schools. We depend on them to assist us with contact tracing when there is a positive case within the school. And it's time consuming for the schools to be able to help gather that information and make notifications to those within the school that could have had an exposure. We will continue to make tweaks to our processes as we move forward, as you know, it's just a few weeks into school now, but continue to have weekly conversations with school superintendents to do what we can to improve processes and help them any way possible.
I appreciate that because I've spoken before about the importance of these schools and keeping the children in, and I see the schools really trying hard, at least here in Bonneville County and the ones that I've been able to visit and the school board members I've spoken to. Everybody's trying very hard to wear the face coverings, to do everything they can to keep it down. We knew it would be a challenge, and there will continue to be cases, but I just see them working very hard, and I'm so appreciative of that, and I hope that all school districts will. Mr. Lake, you had a question?
Yeah, my question is, Jerry, when you're interacting with the school districts, are you primarily interacting with the superintendent, or do they have the staff resources to handle this, dealing with the COVID stuff? Here's where I'm coming from. These guys are busy just doing their day-to-day jobs. And now on top of that, it seems like it's a full-time effort. When you're in a school district that's got several schools, who's actually, are you working with? Are you working with individual schools, or how's that working?
That's a good question. And the answer is, it varies. Sometimes it's the individual superintendent, other times it's the principal. Other larger school districts have other staff assigned to work on that with us for the contact tracing. But it does vary by school district. And as you said, it is very time consuming for them and resource intensive. And I'm sure it is putting a strain on every single school district having to deal with this, in addition to just the normal school activities.
Okay, thank you.
Other questions?
Mr. Chairman.
Yes, go ahead, Commissioner Miller.
You know, I find this interesting. We talk about the school districts, and I had an interesting call from one of the board members up here questioning why some districts have 7 days and we're on 14 in Fremont. And I think that individual reached out to the public health, and I appreciate that too. But only thing I could tell her is our guidelines is 14 days and for isolation. And why would you want to err on the side of having a problem rather than caution? And so I wish all the districts could be uniform in how they do it. one district looks at what another district's doing and why aren't we doing it this way? And I think that's an internal thing for the district board, but I hope we can encourage them all to be consistent with one another, because it does create a problem.
All right, thank you for that comment. Yeah, it's difficult. I hate to see these kids out, and missing school. But we understand the importance of a whole to keep the entire school open and going. So it is a difficult issue, and just encourage everyone to continue to do the best that they can. If there's no other questions, let's go ahead and move on. We do have one action item on our agenda today to consider rescinding the order of restriction for Custer County, who has been under to exceed 7 days. Is that correct?
Yes, Mr. Chairman, they have been under the threshold of 15 per 10,000 population for 8 consecutive days as of yesterday. And so I do have a draft order to rescind the restrictions that have been imposed by the Board of Health. Again, that it does include requiring face coverings when in public space and physical distancing cannot be achieved, as well as the restriction on gatherings.
Well, we're glad that that things have eased up there a bit, and wish that for all of our counties. Certainly will continue to. Is there a discussion from the board on this? Commissioner Butts, it's your county. Any comments?
And actually, I'm straining at the moment to hear. I just lost the volume on this, but for us, I think it's just important that we have our schools open and that we continue to keep our schools open. So I think that the work that all of our superintendents are doing in Custer County is extremely important. And I'll leave it at that.
And Mr. Chairman, may I just add that I did have a conversation with a superintendent from Custer County yesterday in anticipation of this dialogue this morning. And our conversation was, even though that masks are not required by an order, it is still public health's recommendation that people wear face coverings, and how important that is in schools when physical distancing is not able to be achieved.
That's good. I appreciate that, because even when a county does fall below that metric and they move back to the minimum risk level, our plan still does ask that everyone would continue to do all the mitigation strategies that is required in the other. And I think it gives everybody a good opportunity to just continue on with good practice on their own. Is there other comments? Or if not, we would need a motion to rescind this order.
I move that we rescind the restriction order in Custer County.
Thank you, Dr. Nelson. Is there a second?
Commissioner Butts will second.
Thank you, Commissioner. Discussion on the motion? Hearing none. All in favor, say aye.
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 Is there anyone opposed? And did anybody abstain? All right, thank you. So we'll go ahead and do that. Again, we're glad for that. We hope that type of progress and happens in all counties. We realize that it is very challenging right now with schools open, and hope that everybody will continue to follow all the mitigation strategies that are certainly proven. I want to particularly say how glad I am and give my thanks to Dr. Nelson and the other doctors, medical professionals that were in the meeting today. I think we received some very good information, and hopefully it did help us understand why there are conflicting views, sometimes even amongst doctors, but we understand the importance to go right to those who are really in the science and the specialists that are dealing with this very issue. So thank you. Anything you'd like to add, Dr. Nelson?
Sorry, I'm in a meeting, a different meeting.
Well, thank you, Dr. Nelson. I know how busy you are, but thanks again. Are there other questions from the board or comments before I close the meeting?
So, Mr. Chair, I just would like to clarify the intent that we will plan to meet next Thursday. And at that time, if warranted, any action would be taken for those counties that have exceeded the 3-day threshold to warrant an order of restriction.
All right, thank you. So our next meeting will be October 8th at 7 a.m. And again, my appreciation to this board and particularly the staff at East Idaho Public Health, our director. This
Actually, it would be October 1. Is that correct?
Oh, I'm
Next
sorry.
Thursday?
October 1st. I apologize. So October 1st at 7 a.m. But again, thank you to everyone. It's challenging times, and I appreciate the efforts of everybody to do the best that we can. And so with that, I'll call this meeting to a close. Thank you very much, everyone. Enjoy this good fall weather. I hope everyone can outside. Stay healthy.
Thank you.
Thank you.